Hi guys, I hope you all had a good summer. I know it was probably really short for everyone, but I'm really excited for this year. It's our last year for our MPH program, and it's been really awesome and exciting. There's been a lot of changes, and it's great to see that the program's building up. So that's fun. We have a lot of new students, which we've all had classes with, and it's been awesome. So for our first discussion, let's see. Leadership experiences, style, and preferences. Um, I guess it kind of depends the situation. If I like to be a leader or a supporter, follower, sometimes I do like to take charge and um, be a leader. And sometimes, if there is a really good leader, I like to kind of watch how they do things and learn from them. So in that kind of case, if there's a really good leader already, I just kind of like to learn from their style. Um, and it's helped me become a better leader for when I do lead things. Um, Experiences with leadership. I have had some experiences. I like working in teams a lot. I used to play softball, and so I was one of our team captains, and that was like a big deal of ours back then, I guess. Um, and glass blowing too. I used to be really into glass blowing, and so when you're doing glass blowing, it's really dangerous. You're working with really hot materials, and usually people get hurt. And when you do get hurt, you get hurt pretty bad with that, so you have to be really careful. But you work in teams, usually teams of three, and then whoever's like piece it is that you're making, that's the person who's sitting on the bench and doing all the work. That's kind of the leader. Um, so you have to work with your team, and it takes really good kind of leadership skills because you have to direct everyone and tell them exactly how you want your piece done, and it's fun. Let's see, experiences I've had with program planning, program implementation, and or program evaluation. I used to be a project specialist for Hawaii 5210. I'm not really doing that as much now. I still kind of help out here and there, but I've started working a full-time job at HMSA, so that's kind of taking up most of my time now. But when I was there, we did a lot of, I helped with a lot of program planning and, of course, program implementation. I didn't really do too much program evaluation there. Um, but my current job working at HMSA, I do a lot more of that. We have, so I work with the members that are on Quest. So we do like people who are on like Medicaid and Medicare, and people who are like really, really, really sick. So we work with people with special health care needs, and then the long-term services and support, which are people who are very, very sick, and usually really, really poor. So they don't have the money to get medical care. And so with that, we do a lot of program evaluation. Um, and that actually is what I'm doing for my fieldwork experience. I'm going to be, we have a program called Self Direct, so I'm going to be doing a formal program evaluation for that program. It's a pretty cool program, so I want to save some of the details for you guys for our other class that we're in, so I can share more of that with you guys. Um, yeah, let's see. So I kind of want to work with a target population similar to what I'm doing for my fieldwork experience. So those on like Medicaid and Medicare in Hawaii. Um, I think that it's a really underserved population, and there definitely is certain areas of the island that have a more higher concentration of this population. So just identifying those areas is important, and it's working with the families, the children, the parents, the grandparents, everyone. So there's a big age range, so that's kind of hard to narrow it down. But it does affect everyone. So I think that's important. So I do kind of want to, for this term, focus on a program planning project to serve kind of like a prevention program to help prevent these people who are either diagnosed with an illness or who are at risk. Kind of come up with like a prevention or like a preventative program, whether it's like to get to see for them to get to see their doctors or a health center or something, so that it could encourage them to prevent illnesses, I guess. So that's kind of what I'm trying to wrap my brain around, figuring out something like that. But I think that's it. I've been blabbling on for a while. I'm gonna go kayaking. So I'm getting ready to go to the beach. But yeah, that's pretty much it. I hope you guys have a great day, a great week. I'm really looking forward to learning from you guys, learning about more about program planning. It goes really good hand in hand with my fieldwork experience, planning and evaluating programs. And I look forward to reading your guys' posts or watching them, I guess. And yeah, have a good rest of your day. Bye.